Good afternoon, Cedarfield family. This is Michael Shaw, serving as Executive Director. It's April 24th at 3 o'clock. Thank you to everyone tuning in here on Friday afternoon. Those of you who are listening tonight, thank you for taking the time to listen to some information about COVID-19 communications around Cedarfield. I hope that you are continuing to tap into things that really mean the world to you, especially music. Music is one of, Renee will tell you, there's music just constantly playing in my office. When I'm in the car, I'm playing music, and certainly when we're at home, there's music in the house all the time. And Carrie Underwood is definitely one of my most favorite singers on planet Earth right now, and that is actually one of my favorite songs. So, COVID-19 communication. We have been really focused on this particular topic throughout the week, and we are really interested in trying to strike a balance between privacy and confidentiality and transparency. So we are committed, as hopefully those of you that have been viewing these live streams all week, and quite frankly, have been viewing these streams for the last 8 weeks. Hopefully you all have been noticing a commitment to provide everyone with timely and accurate information so that you can make decisions, so that we are ensuring the health and well-being of the residents and the team members during this worldwide yet community pandemic. So there are 6 categories that we have been referencing over the last week related to this COVID-19 communication. The first category has to do with our preparedness plan. And just to touch on a couple of things that we have mentioned throughout the week, highlights for us on the team. One really specific thing that we have been working very diligently on is working on the team members and other folks that are coming to Cedarfield, following specific entrances to use when they get to the community. So yours truly comes through one entrance. Renee, who comes to work, comes through another entrance. Matt Dameron, our Associate Executive Director, comes through one specific entrance. But more importantly, all of the team members who work in either the licensed area and or independent living have a very specific entrance that they need to utilize in order to come into the main building. That is a very hot topic for the Department of Health. Secondly, we've been really doing an awesome job this week of restricting the sharing of team members between neighborhoods. We have 7 neighborhoods in the licensed area and independent living. So we are really focused on making sure that those staff only stay in that neighborhood. We are super laser focused on residents staying in their room. Not only in independent living and in the cottages, but also in the licensed area. And I'm going to touch on that one a little bit further because we made reference to this in our letter today and our letter yesterday. So I know that's a frequently asked question. We are screening team members not only at the gatehouse, but we have begun screening specific team members in one of the 5 different neighborhoods on the licensed area. We have implemented a universal use of face masks, and those residents that are isolated in independent living and or in the licensed areas, we have not only the appropriate signage outside of those apartments, but we have the appropriate levels of personal protective equipment outside of these rooms. And probably the lion's share throughout the week of what we have been focused on is infection control practices, which again, I'm going to get into a little bit further when we move down this COVID-19 communication. So this is the first thing that we are really working on going back through our preparedness plan. I had said yesterday or the day before that the Department of Health has combed through that preparedness plan. Our Pinnacle Living office have combed through that preparedness plan, and we are utilizing it as an evolving tool to make sure that we have the most accurate policies in place given new things that are coming up through the CDC and the Department of Health. So that's our preparedness plan, our first category of COVID-19 communication. Our second category has to do with disclosure of information to residents and team members and families. We have said all week long that we will share a cumulative number of residents and team members who have tested and update the number of confirmed COVID-19 tests regularly. So here's a little snapshot of our up-to-date totals. So to date, we have tested across this campus, we have tested 6 residents, 3 of which have come back as positive. And to date, we have tested 5 team members, and or the team members have elected to test themselves. And out of those 5, 3 team members have tested positive for COVID-19. An important point within this category, it is not our intention to disclose the name or the age or the health status of individuals with confirmed test cases. That's not part of our plan. So hopefully this gives you some information, and I'm going to talk a little bit more in this next segment about the most frequently asked question on the campus, which has to do with mass testing, or if you were to talk to the Department of Health representatives, they would call it point surveillance survey. So the third category on our COVID-19 communication has to do with the local health district, our Department of Health. And what is the latest that you have been doing, meaning management, with the Department of Health in trying to eliminate the spread of this virus on this campus? So yesterday, I'm not going to go into everything from yesterday, but if you'd like to re-look at yesterday's live stream that we posted, it has a lot of content in there about the epidemiologist's visit from this Monday, and it also has information in there about a conference call that we had with those epidemiologists, including Dr. Danny Avula, on Wednesday evening for about 90 minutes. So I'm not going to go over all that information again, but I do want to highlight the outcome again of that conference call on Wednesday. Again, there was Dr. Danny Avula, Chris Henderson, our Chief Executive Officer, Dan Etzel, our Chief Operating Officer, myself, Matt Dameron, and 7 other folks from the Department of Health who were either epidemiologists, nurses, and were quality assurance professionals. And we talked on that conference call about 2 things. One was the site visit from Monday and any other items that they would like us to adhere to. And then secondly, we talked about point surveillance survey. So right now the county, so if you would like more information about the outcome of that discussion as it relates to the Monday visit, please again view this live stream from yesterday. There's a lot of detail in it. I just want to highlight the point surveillance system survey aspect. So right now there are 73 nursing homes in the county, and they are targeting roughly about a third of those nursing homes, and those nursing homes have what they classify as an outbreak on those campuses, which is 15% or more within those sites. So at this point, we don't meet that criteria as an outbreak. We don't have more than 15% of our population in an outbreak, and to be considered an outbreak. So that's the first criteria. If we were to do point surveillance survey, do we have more than 15%? And I'm not talking about 15% around the whole community, I'm talking about specifically in either assisted living or the health center. So they meaning the epidemiologists, helped me understand that when we do mass testing, it's a point in time to give you information. And it's only as good as that point of time. So while it may give us negatives and positives, if we were to employ the theory of trying to track down positives and negatives, once we actually start to do that, you have to keep following it every shift, every day. And the Department of Health helped me understand the complexity that's involved with that, and the lack of resources and tools that no health district even has to even offer a Cedar Field to be able to utilize those tools to track that data, because it's not just tracking a positive or a negative, it's tracking a whole bunch of other set of data points to truly track down that surveillance. Not even to mention that we don't have the testing capability in Henrico County to be able to do mass testing here. In our example, if we were to do it in the health center, that would be 60 people plus roughly about 100 staff members that work up there. We would be testing, in theory, 160 people every shift. And those resources are simply not available in Henrico County. If they were available in Henrico County, the epidemiologists cannot offer us a tool, a resource tool to use to even begin tracking intelligently and using data and science to follow what all of those reports would say. So I hope that puts some, I know there's a lot, obviously there's a lot of discussion, there's a lot of opinion, and a lot of debate about an approach to take here at Cedar Field, or at any nursing home, or at any outbreak. So I know those of you that are watching have an opinion as I'm delivering this information about what I just said. What the Department of Health has told me is that the number one thing I can do, or any other nursing home in the county can do, the most effective resource of time and talent and training and communication that we can do revolves around aggressive, vigilant infection control practices. And so that is our approach. It's been our approach for the last 8 weeks. We have it highlighted on every morning at 8:30, we talk about, do we have the right number of team members throughout not only independent living, but on the licensed side, practicing infection control. And what the Department of Health is going to, I hope to get an email from them tonight, confirming that they're gonna help us with the resource that they have at the Department of Health level and develop a more aggressive plan so that they can teach somebody that we designate here at Cedarfield to be that chief infection control officer, and their responsibility is only infection control, nothing else. So I'm awaiting information from them as they're digesting our offer. We were one of the first communities within Henrico County to even ask for that resource. And so hopefully next week I'll have some more information about what that looks like in total, a little bit more structure, as we begin on our own to aggressively go at infection control even more than we did over the last 8 weeks with a new plan that we've started today. So hopefully that gives everyone a little bit more color around how we're partnering with the Department of Health. The fourth area of our COVID-19 communication has to do with team members. Team members who test positive are not permitted to return to work until they're released to return to work by a physician. And so Matt Dameron and I are asking some team members to quarantine themselves for 14 days due to some practices that we have seen. We're asking some people to test, mandatorily test, which they have, and then some other team members have tested on their own. And I shared the quantitative approach to that earlier a couple of minutes ago about the number of team members who have gone through that testing. So this is the fourth area of our communication plan. Our fifth area has to deal with confirmed cases. We've made a commitment in the beginning, back in the beginning of March, that if and when we had our first case, any case thereafter, including the first one, that we would communicate with the residents and the families and the team members about each specific resident case. And so today, for those of you that may not have looked by your front door or in your mailbox, today we issued another letter which states that last night we did receive communication from the Henrico Health Department that our first independent living resident has tested positive for COVID-19. This particular resident is currently at the hospital, and we do not know yet when this person will return to the community, which brings the total number of confirmed diagnosis of COVID-19 at Cedarfield for residents to 3. So our team, our healthcare team, led by Matt Dameron, and our independent living wellness clinic, led by Ann Hopper, are working closely with the Henrico Department of Health to identify any other residents or team members who are potentially exposed. So once we have a confirmed case, we follow a tracing to assure ourselves that other people were protected when they were in and around those folks. The residents, their responsible parties, the 3 that I just mentioned, and the team members who have been potentially exposed to the virus have been notified today, and we're working with them. The next part of the letter that we distributed talks a little bit about the all-importance, critically important, that all residents remain in your apartments or your cottages or your healthcare room or your assisted living room unless it's critically essential to your health and well-being. So why do we keep putting that sentence in there the last 2 days? First of all, if it's critically essential to your health that you get out of your apartment or your cottage or your assisted living apartment, then please do so. Go for a walk. Enjoy Mother Nature. Get some fresh oxygen and just get outside and stretch your legs. You can certainly do that. We are not in a lockdown mode right now. Not even close to a lockdown mode. And we want you to stretch your legs. We are stressing this because as human beings, once we start getting into a rhythm, some things potentially kind of scale off a little bit. One of the items that has scaled off a little bit in the cottages and the independent living apartments is when our runners, our dining services runners, are delivering your meal to you in the cottage or independent living apartment, even in assisted living, when we're coming to you in assisted living. You now see the routine of when they're about to get there. And so people are waiting in the hallway, ready to receive the bag. And that transaction of handing you that bag is less than 6 feet. And so one thing we really need to tighten up here is, I know you want to see a human being, I mean that makes sense, and you want to see the runner associated with the dining program, but if you could please refrain from meeting them outside your apartment, and more importantly, don't tempt them to provide physical touch. Some residents have been asked, can I give you a hug, or thank you so much for delivering my meal today? And so we need to get back to a couple little basics with the meal delivery program. As we did in the beginning of just dropping off the meal, and now that you know the rhythm, you can look for your meal accordingly outside of that door. So I think they're actually knocking on the door, if I'm not mistaken, just alerting you that the meal is there. But if you need to go outside, please go outside. You're not under lockdown yet. All team members are continuing to use their appropriate masks at all times. I have mine. This is mine that I walk around with and wear. We're delivering direct care to healthcare center residents, team members. Those folks are also critical in those areas that they're wearing the appropriate personal protective equipment as directed by Matt. And we really need to continue to practice self-isolation, social distancing, great hand washing. That's one of the keys here. So if we're tempted to go near our eyes or our nose or our mouth, if we have clean hands, that would be better if we happen to touch our face. So hopefully many of you received good information from that little PowerPoint presentation we had yesterday. For those of you that did not have a chance to tune in to the live stream yesterday, I would go back to yesterday's recording, which is posted on mycedarfield.com with yesterday's date, and review that. The segment where we had the Health Pro Heritage talking about the COVID-19 was a really time well spent of 9 minutes to really describe the do's and don'ts for folks. So that is my COVID-19 communication update. If anybody has any questions, any concerns, or a simple comment about this plan or our approach, please feel free to call the administration suite. I truly believe that the antidote to fear is good communication. Without a shadow of a doubt, the more we're talking with each other, the more that we are brainstorming about ideas, the better off we all are. And so please feel free to reach out. We're trying our hardest Renee and I are trying our hardest to filter through the volume of calls, which is fine with us. We have a system, we have a really good system. Renee's shaking her head over there. We have a really good system of putting calls in a different priority given the level of what type of call it is. And we're trying our hardest to call back or email or texts in the same day now. So that's our COVID-19 update. One more piece, the sixth piece, which is probably the most contested part of our communication plan. Many people feel that I'm trying to cover things up here at Cedarfield, but this will be our standard of practice, that in the unfortunate death that a person with a positive diagnosis passes away, because I don't know for sure, nor does anybody, whether or not that actual positive test was indeed the reason why someone passed away. We don't know that. We will continue to use the processes that we already have in place to share the news of a death of a resident who has lived at Cedarfield. We will use the traditions that Florence and Trish and Margaret have put in place over the last several years, and we will continue to utilize those means of communication and traditions to honor a life once lived at Cedarfield. Out of respect of the residents and their families and their loved ones, we will not be sharing any personal information related to the death of the resident and not sharing it with the news media. We've never started to talk about people dying about congestive heart failure or cancer or Alzheimer's disease or the whole other list of things that people pass away about, and we are not starting to announce people passing away with COVID-19. It's not been our practice, and we don't know whether that is true or not to begin with. Now is not the time to deviate from privacy and family commitments by making public announcements, but to let people know that, as we always have when we have lost a resident, to do that in a very reverent way and how we intend to celebrate that person's life. Hopefully I have been clear about our stance here at Cedarfield, not only at Cedarfield, but this is a pinnacle living practice across 5 campuses. Okay, next update or segment has to deal with the families. Those of you that are near and far, I did make an announcement yesterday, which I want to make a clarifying statement. Yesterday I made an announcement that I was going to call all of the powers of attorney and or the responsible parties to let them know that they can utilize mycedarfield.com as a way to get information here at Cedarfield, so they didn't have to rely on their loved one to give them timely, accurate information. One clarifying statement: that phone call was made to the powers of attorney and responsible parties for those that live in the nursing home, in assisted living, and in Sunshine Plaza. I did not call, for those of you that are tuning in and or listening tonight that live in the cottages or the independent living apartments, I did not call your power of attorney and and I did not call your responsible party. You are independent. You're not declared incompetent or incapacitated, and I am just assuming that you can get them that information that we share here, or at least explain to them how they can log on to mycedarfield.com to get information. So I did not call independent living powers of attorney. Those that are listening tonight, our supply shuttle program is continuing on Monday with folks that live in the independent living apartments. So feel free to drop off some supplies in a brown bag for those living in the main building in the independent living side. And then next week, our transportation folks will continue with grocery shopping Monday through Friday. As I described, I think yesterday, on average, we have a $3,000 bill, almost 20 shopping carts, heaping shopping carts of supplies throughout the week, and we are serving almost 150 people throughout the week through this program. So thank you to Ann Reed, thank you to Beth Rutherford, thank you to the team members in Wellness and Leisure for helping out with not only the shopping, but as they come back and they sort through all of the shopping product and put it in a nice bag and then deliver it to the residents. So it's a great program, it's been very effective, and we'll continue that next week. Anybody has any questions, feel free to text right now. Renee's at the table here taking questions. We'll go on to a couple other things, administrative updates. This is just a plug for nutrition. Our dietitian, Karen, I think I spelled her name wrong. Karen has a segment on Wednesdays at 11 o'clock. Please tune in. Wednesdays at 11 o'clock. I think it's every Wednesday at 11 o'clock. She has a segment for you. She will also be joining us on Tuesday here through this live stream. She hasn't come up with a topic yet, but since nutrition and eating and vitamins are just really critical right now to boost our immunity, she has some important information that she wants to share with you so we don't lose sight of how we're feeding our body with the right things in order so that our body can fight off any infectious.
Question, is it changed from 1 o'clock to 11? Because it used to be at 1 p.m.
It used to be at 1 o'clock.
Yes.
I got word it's 11 o'clock.
Okay.
We want to make a clarifying statement. Thank you, Eddie. Yours truly has been reviewing this book that I mentioned yesterday. If anybody would like to order it, I was trying to read it last night, some bits and pieces of it, and just I crashed at 11:30. But some of the, as I was skimming through it, some of the content seemed very relevant for our population. So it seems like a good read. Next week, I'm going to try to read this book over the weekend and then provide residents some details, maybe a little Cliff Notes version of this book. So this week is Volunteer Week, National Volunteer Week. We want to give a hearty thank you to all of the residents, from council president, everybody who works within the council, all the area reps, the flower committee, the garden angels, those of you that make cards, those of you that take residents on trips, maybe not right now, but pre-COVID-19, all the residents that have volunteered over the past year to make Cedarfield just a special place we wanted to say thank you. Thank you. Volunteering, as my grandmother once said, and I don't think it's a direct quote from her, but volunteers are love in motion. Volunteers are love in motion. It takes volunteers to move the world around. And so this is the week that we would be gathering in this fellowship hall to celebrate our volunteers. Thank you to Lisa G, our volunteer coordinator. Many of you don't know her. Many of you know her, but you haven't even actually met her yet. She's doing an unbelievable job right now of connecting residents through volunteering. So Lisa's here. She's doing an incredible job. I can't wait for all of you to actually formally meet her. Maybe we should have her next week as one of our guests here. So thank you for all that you do. Everything that you do on behalf of volunteering makes this campus stronger. So we appreciate you. Again, I made reference yesterday, Careers in Aging Week. We celebrate this week every year. Celebrate the awesome vocation that is available to many different disciplines, many different education levels. And so if you know somebody, or maybe if you don't know somebody, while you are talking with your family, while you're talking with your friends, while you're talking with loved ones, could we all make just a huge commitment right now to give Cedarfield a plug in your daily conversations with people, and just simply ask folks if they're looking for a job, have you considered looking to see what Cedarfield has, what Cedarfield openings we have, whether full-time or part-time. Even if we don't have it available, we're constantly keeping a database of people who want to work here, people who fit our mission, enriching life's journey, people who want to help with our vision statement of redefining what it is to age and to break down the stereotypes of ageism. And then more importantly, we have 6 values that we live by. It's the glue that keeps our campus together. And we're looking for people that want to help us serve people 65 and better. And so that is the purpose of this week, is to bring awareness that it is an awesome career, it's an awesome vocation in life to work at a retirement community such as Cedarfield. Oh, so that is a clarifying statement. Thank you, Eddie. So I did make one. I'm going to go back first. The dietitian Karen's nutritional segment is on Wednesdays at 1 o'clock, not 11 o'clock. Thank you. Okay, any other questions, Renee? No other questions. Okay, Trish Carter is here for some words of spiritual health.
Good afternoon, Cedarfield. I'd like to read to you a short passage written by J. Barry Shepherd. It's called Recollection. I have a hunch that much of faith is formed in looking backward, taking stock, reflecting on what has been and what might have been. Most of the time, you see, we're far too close to things to view them properly. The hassle, hustle of every day can blind us to what's really going on. Obscure for us the chasms and the pinnacles that mark the landscape of our living. It's only when and if we take the time to glance across the shoulder and reflect, to pause and ponder where we are and how we got there, that we can trace the constant presence of a mystery that blesses as it wounds, that turns us inside out and upside down, that leads us by a path we did not choose, toward a hope we hardly knew we had, a trust that yet endures despite so much, a strange, familiar grace that touches everything we touch with promise. I'll bet even old, stammering Moses, leading his motley crew across that gap between the waves, had no time to inquire who put it there. He just saw a chance and grabbed it with both hands. Then later, on the other bank, or deep in the wilderness, he realized. So that's what God was up to all that time. Next, I'd like to introduce a new segment to the live stream called Good News. And I think we can all agree that we could use some good news. Mary Ann Baker has a great grandson. Eddie, I don't know if you can zoom in just a little bit toward that screen. Baby Wyatt was born April 22nd. And I can tell you that Mary Ann Baker is very proud. So if you have some good news, please be sure to send it in, because we would love to celebrate some good news at Cedarfield. Have a great week.